The topic of discussion today is one that is of great interest to every mother out there, and that is the topic of breastfeeding. However, breastfeeding is not only a concern for mothers. Nurses, especially those working in labor and delivery, have a huge role in the breastfeeding process. Nurses are one of the key care providers in the delivery process, providing care for the mother during labor and helping care for the baby after. The role of the nurse in the delivery process and after is critical. Nurses can be found throughout the entire process, supporting the mother and providing information throughout, from being first to assess the baby, to bathe the newborn, to making sure the baby is progressing well. Nurses are involved in the whole process of bringing life into the world. And then comes the all-important first feeding. Here is when the new mother must decide if she's going to start with bottle feeding or breastfeed her infant. Let's pause here for a second. It is very important to note that some mothers cannot breastfeed for a variety of reasons, and it is the role of the nurse to be understanding with this and help with formula feeding instead. The rest of this video is meant to address mothers who are able to breastfeed. A lack of breastfeeding can impact the baby's overall health in many ways. Let's take a look at the benefits of breastfeeding. Breastfeeding has been shown to help improve the baby's immune system, provide proper nutrients, aid in proper development, help with mother-baby bonding, and assist with mothers losing baby weight. But nurses, did you know that there is another benefit to breastfeeding that has long-term implications for the child? This breastfeeding benefit is logically all about eating. There is evidence to support a connection between breastfeeding and satiety. That's right, breastfeeding can help regulate appetite. To refresh your memory, satiety is the post-meal sensation of fullness that suppresses the urge to eat further. Clearly, this is important. If we didn't have satiety cues, we would not be able to know when to put away that bag of popcorn or say no to the third piece of cake. There are other benefits to satiety. These include reduced overeating, improved response to hunger, better eating style, and reduced obesity. As nurses, don't you think it would be great to have patients who exhibit these traits? Having better eating habits translates into fewer serious health problems overall. So how does the satiety concept relate to breastfeeding? According to the literature, breastfeeding works to help develop satiety. So, if a mother decides to breastfeed her baby, she is also improving the likelihood that her baby will have a good ability to self-regulate food intake. However, this connection is not only because of the actual breast milk, but rather the behaviors related to breastfeeding. In infants who were bottle fed, they were less likely to be satiety responsive at 3 to 6 years of age. If babies were pushed by mothers to empty their bottles, they were also less likely to be satiety responsive. Feeding infants directly from the breast decreases the mother's awareness of exactly how much the baby has consumed, and she must allow the baby to decide when to stop feeding and follow the baby's cues, showing he or she has had enough. So what is the key message in this for nurses? What message do you want to send home to your colleagues, and how will this impact your practice? As a nurse, you very likely want to encourage the best possible health in mother and baby. Hopefully, this includes facilitating breastfeeding in mothers. Even though the satiety cues that developed from breastfeeding were not correlated with a lower risk of being overweight, there are other benefits of accurate satiety cues later in life. In the future, those babies will be adolescents choosing what and how much to eat. Having good satiety will help them to not overeat. And then they will be adults buying food for themselves and their families. Their satiety responses are likely to be well developed to properly regulate how much they eat, leading to better overall health. So, in a nutshell, what have we learned today? Breastfeeding has lots of benefits. Nurses have a huge role in encouraging mothers to breastfeed. Breastfeeding increases satiety responsiveness, and good satiety has lifelong benefits. Now nurses, going forward in your day-to-day practice working with mothers, hopefully this connection between breastfeeding and satiety will inspire you to further assist and encourage mothers to breastfeed. Your job as a nurse is not an easy one, but the rewards that come from helping mothers and babies achieve optimal health through breastfeeding are lifelong, and for this we are all sincerely grateful.